Soranis is a medical device company founded in Houston, Texas by Mehdi Razavi. He's an electrophysiology physician who wanted to come up with a way to identify a bleed well ahead of it being a complication or issue for that patient.
The idea of the early bird came to me one day when I was sitting in traffic. What was happening is I was operating in two different hospitals, and I had finished a case in one hospital, and I was contacted as I was traveling, going to the other hospital. I was contacted that one of the patients, their blood pressure has dropped. And of course, at that point, and it still is, the biggest concern you have is that there's an internal bleeding complication that's occurred. So at that point, I was thinking to myself, I wish there was a way that we could detect this and pick it up earlier, because the early detection doesn't just make a difference for me, but it actually is a huge difference for the patient. And I had a moment of clarity there. And if I know that there's blood in a certain space, that the electrical properties of that space will change. And I said, let's embed those electrodes on the tip of a sheath. And those sheaths are, they're where all the action is. That's where the blood vessel is being interrupted, is at the tip of the sheath. So if you're there, you're right at the forefront of being able to image any kind of bleed, even if it's early in the process. This is the dilator. You remove the dilator. Here's the sheath itself, and here's the actual kind of the hardware of the sheath itself that measures the impedance. It tracks it over time. It alerts the clinician how severe, how progressive that drop in impedance is. And we have data that shows that the change in that impedance correlates not only to the extent of the bleed, but the actual rate of the bleeding. And that gives the clinician plenty of time to take action.
Yeah, so a few decades ago, the first angioplasty procedure was done in the United States, and that's led to basically a revolution in less invasive medical treatment and really opened up medical procedures to patients who normally wouldn't have been able to undergo a procedure to improve their cardiovascular health. The impact of these procedures on bleeding has been fairly significant. Almost 1 in 5 patients could have a bleeding complication. Our device comes into play in these procedures in order to basically prevent those complications from occurring. We don't prevent bleeds, but we do provide actionable information in order to allow the physician to react prior to a complication.
We value new technology. We were the first ones to place an early bird in Louisiana, and now all the cardiologists in our practice have adopted the technology because they've seen firsthand the benefit of it. We have an EP doctor, he's using it in his practice. We're started placing the TAVR transcatheter aortic valve replacement. We're going to use it in that procedure, and all the interventional cardiologists that do complex intervention have started to use the early bird.
When there is a complication of bleeding, it is devastating to the patient and the patient's families. With the early bird detection system, if we can get in there, act appropriately and quickly, and take care of everything with the patient so they can actually go home the next day, instead of having a huge hematoma where we have to hold pressure for hours on end, and then the patient has to lay in bed longer.
If we have complications of bleeding, like a significant hematoma or a retroperitoneal bleed, we have to hold those blood thinners, and holding the blood thinners can complicate the procedure. So early bird first interested us because it allowed us to monitor for those significant bleeds with objective data. So it allowed us to feel better about putting a large 12 French or 16 French sheath in the femoral artery if we knew that we were monitoring for retroperitoneal bleed afterwards. And also helped us depending on what level of care we sent the patient to after the procedure. If we were concerned that the patient was high risk for bleeding because of their age or renal function, often we would put them in the ICU, not because they needed ICU level of care, but we wanted them monitored closer. So oftentimes, because we had the early bird on, we were able to put them in the Heart and Vascular Center, which is a step-down unit and a lower level of care. It's a new technology, but it's not, it's easy for us. Every cardiologist, every interventional cardiologist is very comfortable putting in a venous sheath. So the technology adds a lot, but it isn't a difficult or dangerous procedure to place the device. Oftentimes after abdominal aortic stent grafts, we will keep patients 48 hours because of risk of bleeding. But with the objective data from the early bird, we were able to feel confident that the patient was able to ambulate and go home the day after the procedure. So we cut out a day of hospital time.
Everyone knows and everyone's been told that an ounce of prevention is worth a pound of cure. I think if you magnify that by 1,000, perhaps it's as true then in medicine as it is in the rest of our daily lives. Detecting a potential complication early on is very close to basically saying eliminating that complication. For the most part, if we know about a problem like a bleed that is occurring slowly but progressively, we can do things. We can do a lot of things. It's the absence, it's the lack of that knowledge that kind of holds us back. And I think in a way this has freed the operator to manage their patients with a lot more confidence, and that way you improve the outcomes. You know when something is going wrong and you can immediately take action.
Someone did come in and speak with us. In fact, it was a nurse, and he explained everything to me about the early bird and what he was coming in to check and to monitor, and it was wonderful. It was good, very informative.
Just a one-night stay at ICU because of the early bird that they put in there.
This was done in December, just right before the holidays. It was Christmas Eve. And Dr. Wilklow did say to us, procedure done and home for the holidays. And so it was wonderful that, we went in, but we were also able to come out actually before Christmas Day, which was wonderful.
I believe as a patient with it, I can say that it's safe. It's the best thing really, because you're not worried about if I'm bleeding there and no one can find out until there's a problem. And that's a peace of mind right there, that you just sit and relax, and you know that eventually in the morning the nurse will remove it, and everything went well, very well.
When I was in the car that day that folks were telling me that my patient has dropped their blood pressure, if I had had a Serrano sheath, everything, all the stress that I had, all the concerns I had for my patient would have been addressed immediately. And I think sometimes that kind of motivation is more powerful than any other. Improving our patients' outcomes is why we're here. This is why we're doing what we do.